Mostly what you're going to do over the course of the next couple of days is you're going to be working with all these other people in the room. There's a lot of research into teamwork, and everyone kind of knows that it's something that needs to happen, but can be hard to make it happen. And that kind of learning really happens best by having people talk to each other about real-world stuff.
The first question that we ask them to start working in small groups is, why did you start working in healthcare? So bring them back to the basics so that they rekindle and reignite the passion that they had many years ago when they started to work in healthcare.
The amount of expertise in the audience is almost always so much greater than the amount of expertise on the stage. Get ready for the first lightning session and begin.
What our patients told us is that the main barriers they encounter are really when they encounter us in teams or others, they're not listened to. And when they offer their ideas, they're often discounted. And when they bring research information in, it's often ignored.
Then we ask people to start thinking about issues that they'd like to tackle.
Being and teaching patient-centeredness. How do we engage or support faculty and staff to participate in interprofessional education so it can become a reality in practice?
How to talk with your clients or patients so that they want to be on the team.
How to engage physicians in interprofessional clinical practice changes.
There is no more money. So now what do we do?
So once the agenda started to get built, people would then go into breakout sessions, and we'd have up to 15 breakout sessions at any given time.
You feel like you're walking away truly having gotten to know a lot about a lot of people and also to share a lot of information.
I'm hoping that at a tomorrow that I'll get some more concrete tools to add to my toolbox to make the changes in my organizations.
We need terms around which we can have some agreement what they mean.
So what we wanted to do is to say to those that are trying to do this in Canada, that are trying to build teams on the ground, we can connect you with others that have confronted some of the similar barriers that you're facing and trying to do this in your workplace. And you may be able to learn something through a healthy exchange about how to confront some of those obstacles and actually how to find some of the enablers that exist within healthcare organizations and systems to move towards building effective teams.